Hello and thank you for joining me. My name is Sarah Harvey and I'm going to talk today about how I help people feel more confident about communicating with others. This is an overview of what I'm going to be talking about today, and I will share a copy of the slides at the end of the talk via the chat function so that you can download them for reference. I'm happy to answer questions as we go along. You can type questions by clicking on the Q&A button, which is on the bar that's usually at the bottom of your screen. You can also click on the raise your hand button, and this lets me know you have something to say, and then I can allow you to switch on your microphone so that you can speak to ask a question if you'd like to do that. This is quite strange from my point of view because although I'm talking and presenting, I can't see or hear anybody, so I don't get any feedback from you, which makes me feel a bit awkward, but hopefully it's going to be okay. But do feel free to ask questions as we go along or save questions for the end, and I'll do my best to answer them. Okay, let's get started. So my name's Sarah and I'm a speech, language and communication therapist. You might notice that I've added an extra word to my title. I've added communication because the term speech and language therapist can be a bit misleading. People think you help with stammering or strokes or speech delay, which some speech and language therapists do, but our jobs are a lot wider ranging than that. And the bit that I specialise in is social communication. So that's helping people to interact and feel okay about being around other people. I work directly with children and young people, particularly to get to know them and how they experience the world and to build their confidence. However, equally important is working with the people around the child, so helping parents to feel more confident about how they support their child and feeling like they understand their child's perspective. I can also work in schools or nurseries if people want me to, so working with teachers and staff to recognise what works for that child and helping them develop the way that they adapt and support them in school so that the child can thrive rather than just sort of survive the school day. And just to clarify, you don't need a diagnosis of autism to seek support. And indeed, you don't need to be autistic to want support with communication. It's you that I'm working with, not your diagnosis. So I stopped working in the NHS after I had my children. I wanted to be able to offer the input that was needed rather than be limited by what I could help with due to the funding and the commissioning difficulties that we have in the NHS these days. So I now work at a lovely place called the Appletree Centre. It's an independent child and family therapy centre, which means it's not funded by the government. Families pay for their sessions or they get professional funding for those. And I was very lucky to come across them and persuaded them that I could offer something there that they didn't already have. So it's one of those places that's run for entirely the right reasons. It was set up by a couple of play therapists who wanted somewhere tailor-made that they could offer their therapy sessions, because they're used to carrying around huge bags of toys with them and then trying to make sessions work in entirely inappropriate spaces in school. So they wanted somewhere set up to be able to offer the therapy that they were trying to offer. And it kind of grew, and now it's this wonderful centre that's got lots of different types of therapy available, and they're not looking to make big profits, they are just looking to help people. So it's a really encouraging place to work, because you actually get to do what you feel like you need to do with people. Those of you who are from Sheffield, it's on Brocco Bank, just up from Hunters Bar roundabout by Encliffe Park, next door to the big church. And they offer a range of therapies for children and families now who'd like support, including counselling, play therapy, art psychotherapy, drama therapy, family therapy, speech and language therapy, that's me, and autism support, and that's me as well. I thought I'd put in a couple of pictures just to show you what it looks like in the Appletree Centre, because it's very different to a lot of settings that you might have been to for therapeutic input. So it's designed to feel homely and comfortable rather than being more like a clinical surgery kind of room, like a doctor's surgery. The rooms are set up to be adaptable so that there's different types of seats, various sensory support equipment, different lighting options in the rooms. So we can try and make the rooms feel okay for each child and try and make it sorry, I'm just reading the question on the side here. Yes, I will talk about drama therapy a little bit, but I wouldn't like to speak for drama therapists. Give me a minute. I will get to that, certainly. So yeah, we can try and make the rooms suit the child and choose different kinds of rooms depending on what kind of work the child's going to be doing. So this is one of our more general therapy rooms. So you can see we've got different kinds of seating, different equipment available. This is one of the play therapy rooms, which some of the children absolutely love. And depending on what we're doing will depend on what kind of room we choose to work in. Drama therapy, I'm not a drama therapist. So I've had a question asking about drama therapy. Drama therapy is a way of working where they will create stories and characters together. It's mostly child directed, but with guidance from the drama therapist, and they get the chance to explore emotions and difficult situations through a kind of play and drama way of doing things. If you want to learn more about drama therapy, please get in touch with the Apple Tree Centre, and somebody who is a drama therapist will tell you about it properly. At the moment, we aren't offering sessions at the Apple Tree Centre due to COVID. So I'm seeing everybody via Zoom. So this is what it looks like at the moment, which isn't quite the same. However, it is working really well, thankfully. And being online offers lots of benefits that we haven't thought about before. So obviously you can access it from wherever you are. You don't have to be able to travel. You don't have to deal with any of the stress of getting somewhere on time or coping in an unusual environment. So you can be somewhere familiar and safe, which obviously for the kids that I'm working with can be really important. And also it gives me the chance to share resources straight away via the screen share option. So I'm not saying, oh, I'll have to bring that next week. I can just pull it up. So that's another benefit that's been nice. I've got a video clip that I send to families who are considering having sessions with me to introduce myself and explain my role a bit, and that lets the children decide if they'd like to give therapy a try. So I thought I'd share this with you as it's a handy little overview about what I do. So here we go. I get to save my voice for a minute. My name is Sarah. I work at a place called the Apple Tree Centre. The Apple Tree Centre is a place that children can go to if they want some help to feel okay, or if they have lots of problems or worries. My job is to help children to understand more about how we communicate. Communicating is all about how we get along with people, understand them and get our point across. This might be things like making friends, getting along with their family, coping in school, talking about feelings, or feeling okay around other people. At the moment, the building where I usually see children is closed because of the coronavirus. I'm using video calls to see the children I'm helping while the building is closed. It can seem a bit strange meeting someone for the first time by video call. It's strange for me too, but I think we will all get used to it. I like to get to know the children I work with so that we can do things that they think are fun and interesting in our sessions. In the first session, we usually play games and talk. This lets us get to know each other and get used to being in a session together. If the child wants to, they can bring something they're interested in to show me. We can also talk about the things that they would like help with. I really like helping children to communicate and get along with people because it makes them happier and can make their life easier and more fun. So that's me. So for me, one of the most important things is to get to know the person I'm working with, get a feel for how they think and perceive the world, what's important to them, what they like, anything that worries them about the session, their sensory preferences, how I can make sure they feel okay, and let them get to know me a bit, build a therapeutic relationship where they feel okay spending time with me and enjoying the sessions. Once we know each other a bit and I found out about what they find difficult or would like help with, I work to help them feel more confident about communicating and ensure any work we do promotes self-esteem and self-acceptance. We often work on understanding more about how communication works and making sense of how other people communicate and exploring what makes communicating easier for that person. Some children want to develop their abilities to communicate and express themselves, and we can learn about specific aspects of communication and practice skills if they want to, but I would never insist somebody communicates in a certain way. So equally importantly then, what I don't do. I've covered this a bit on the last slide, but I think it's important to be clear on this. I'm not going to try to fix anybody. Nobody needs fixing or for their autism to be taken away. Autism is part of what makes them the amazing person that they are. Everyone's their own person with their own way of being awesome, and you've got the right to choose how you communicate. I'm not going to tell people they should change how they communicate. What I will do is help you explore how you communicate and the impact this has on you and how you feel and what happens to you. My goal is not for you to communicate in a neurotypical way or to learn to tolerate aspects of communication that are uncomfortable. So for some people that might be eye contact, for example. I do understand the desire to learn about social expectations and social conventions and have the skills to communicate in the way that most people expect you to when you want to do that. And I'm happy to support young people to develop those tools if they wish. But I'm never going to encourage anybody to be masking, and I will always emphasize self-acceptance and choice about how you communicate. I hope that makes sense. So far, I've talked about how I support children and young people who use spoken language to communicate, but I also work with younger children and children and young people who are not yet using speech or interacting much with others. I thought I'd give you an overview on how I support these children too. So the first stage is to create an environment and create situations where the child wants to communicate. So making it predictable and highly motivating so that they choose to interact and get opportunities to have positive experiences interacting with others. So I'm helping the child to realise that other people can have a function for them. Other people can help them to achieve something or can make what they're doing more enjoyable. Next, we need to build the underlying foundation skills for language to develop. So things like sharing attention, seeking out others, taking turns in interactions. We then need to introduce some form of symbolic communication. So for most people that's words, but it might also be signs or written symbols or written text as well, or a combination of these. And after that, we work on developing their language skills, usually through play, so that they can make sense of spoken language and they can put words together or symbols together to express themselves effectively. And then finally, we move on to the social communication stage, which is where I started out in the previous slide. I'm going to talk a bit about the different stages in more detail. So when I'm working with either young children or children and young people who aren't really communicating very much yet, they're at a pre-communicative stage where they're hardly interacting, then the first thing I'm going to do is set up a familiar and predictable session structure so that they feel safe and they know what to expect when they see me to reduce anxiety. The sessions are usually all about play, often very sensory orientated play or activities that appeal to the child because of the structure of the game or because of a special interest. I'm in the fortunate position to have trained to play in two different ways. So I've been trained to play in a way that supports communication from a speech and language therapy point of view. But because of where I'm working now, I've been able to complete training courses with my play therapy colleagues as well. So I've learned non-directive child-led play therapy techniques, which I'm able to incorporate into therapy sessions, which I found extremely effective for building a connection with the child. So it kind of gives me an extra way of supporting them to engage in activities. So once the child's choosing to interact and they're trying to communicate more, then we can help them to build their language skills. And this means learning a way to express themselves and to help them understand other people. So this needs to be useful and enjoyable for the child, or they aren't going to try it. So I work together with their family and the children to work out what will be motivating and useful for them, and then we build on that. I also support parents to feel confident about how they can help their child practice the skills we're working on in day-to-day life. We then get to the children who use spoken language and want to learn more about how they get along with people, understand them, and interact socially. Again, I will always focus on what's important and interesting to that child and aim to build a therapeutic relationship with them so they feel confident and happy to engage with me in sessions. Everyone has different goals. These are examples of some of the things that I often support children with. So we often work on making friends and managing friendships. We might work on getting along with family or siblings, coping in school, feeling okay around other people, dealing with conflict or staying out of trouble, and being able to stand up for yourself in a safe and effective way. And a big one is talking about feelings and communicating how you feel in a way that's safe. There are lots of other things that people want to work on as well. These are just some of the common examples. Another big part of my work is supporting children to understand what autism is and what it isn't, and to help them process what it means to them and their feelings about being autistic. So this can include learning information, but also just having a space to talk and share their thoughts and emotions. So I can support parents with how they talk to their children about their diagnosis, if they'd like that. For me, it's important that children get the message that being autistic is just part of who they are. And okay, they think about the world in a different way, their brain works in a different way, and that comes with advantages and disadvantages, but that's okay. And I can help children feel more in control about how people help them and support them to advocate for themselves in a way that's appropriate for their age. So I said at the start that working with parents and carers can be as important as working with the child themselves. I can help parents to learn more about autism and think about it in a different way to how they might have previously encountered the term. So autism, as I said, means that you think about things and experience the world in a different way. But most parents of my generation anyway, when growing up, are likely to only have really encountered the term autistic as a label for a disorder with a lot of negative connotations, rather than it just being a description of a different way of being. So I think that's really important to be coming at things from that perspective. I often work with parents to identify what they're doing as parents that works for their child and investigate how else they can adapt and support their children to make life less stressful and more positive, and build confidence and connection between the parents and the child. Parenting an autistic child can feel overwhelming and exhausting and worrying. So it's not just about learning support strategies and gaining knowledge. You can have all the knowledge you like. But I think what makes a difference is having a relationship with someone who can offer that non-judgmental listening and understanding that can make a huge difference and help you to process some of the emotions you're experiencing. And we have counsellors and family therapists in the team at the Apple Tree Centre who went for anybody who wants to take that side of things further as well. So when I'm working with parents and carers, we usually focus in one of two ways. So parents might want to increase their knowledge and confidence about how they support their child and feel like they better understand their child's perspective. So that can be done as part of a group. So I run a group course at the moment online via Zoom, and that has the advantage that you get to connect with other parents who are having similar experiences to you. Or that can be done individually if people prefer to just have private sessions for that. The other focus we might have is more specific problem solving. So working with parents to explore anything that's a particular challenge and come up with suggestions together for different ways they could approach whatever they're struggling with. So that's looking at a particular situation that's going on for that family, exploring what's helping, what's working already, suggesting different ways of going about doing things, trying things out together, figuring out what could work and building on it, developing techniques that can work for that family. Tell you a bit more about the course that I run. So it covers a range of areas, increasing knowledge and acceptance of autism itself, and then learning more about understanding and supporting communication, and then processing, sensory needs, mental health, and experiences of school. So the course runs on a Monday evening, and the next course starts on Monday the 21st, so that's a week on Monday. So there are a few spaces left. If anyone's interested, please do get in touch. The course has been really well received, and we've got such positive feedback from the parents who've attended that I've made a graph to show the change in how they rated their confidence and knowledge at the beginning of the first session and then at the end of the last session. So as you can see, there's quite a big increase from the blue bit at the start to this green bit at the end. On each of the questions, we've seen a big jump up from sort of 3 to 4 level to 5 to 6 level. So that's really encouraging that parents are finding it really useful. And the course is constantly evolving. I'm getting feedback from the parents all the time about what I can add in, change, take out, explain differently to make it as effective as I can. And we've got some nice comments as well, so I thought I'd put those up and let you have a look. I also mentioned working with teachers and support staff in schools. So if families would like me to, and school are amenable, I can go into schools and work with the teachers there. Obviously, there's restrictions on me physically going into schools at present, but there's no reason I couldn't talk to teachers on the phone or Zoom call teachers if that was something that was wanted. There are various reasons I might do this. So I may go into observing class to get a feel for how a child manages and gets on in the class environment, and also at playtime, because that's also a very key part of their day. I also get to see how the teachers and staff interact with the child and get an idea about what works well for that child and what might be less effective. Talking to the teachers helps me gather information that can support the assessment process, and I learn about the teacher's perspective as well about what's going on for that child. I can work with teachers who'd like advice on support strategies for particular children, and I often work with children who think about what would help them in school, and help them find ways to communicate that to their teachers. So it might include something like creating an information sheet together with the child, or a booklet that they can then give to their teacher or ask to have circulated to their teachers in school. And I've also worked with parents to help them advocate effectively for their child if they were finding it difficult to get school on board with their child's needs. I sometimes attend my plan meetings or parent and Senko meetings as well to feedback on the therapy that we've been doing if the child's okay with that, or to contribute to planning and goal setting, as well as supporting parents in the meetings if they like that. I'm going to talk about supporting the assessment process. So we are often asked about providing private autism assessments. Autism assessments require what's called a multidisciplinary consensus. So that means that a team of at least 2 qualified and experienced clinicians assess together and agree upon the diagnosis. So as a result, although I'm able to be one of the people in this team, we don't have anybody else at the Appletree Centre who can assess. So we're not currently able to provide private assessments, but this is something that we're looking at being able to offer in future. What I can do, however, is write a report detailing all the information that I've gathered from talking to parents and the child and their teachers, and any observations from working with them that will give the assessing team the information that they need for the assessment process, so it can make sure that the right information is getting relayed, because sadly my NHS colleagues are on a very limited amount of time that they're able to spend with each family. So it just helps to sort of streamline things a bit and make sure the right things get highlighted.